diabetes affects over 1 million Americans, yet there is an exorbitant amount of confusion and ignorance surrounding the disease. In my experience, I have found that the biggest lack of knowledge comes from the fact that most people are unaware that there are two types of diabetes, type 1 and type 2. Type 2 diabetes, in most cases, is caused by a lack of exercise, obesity, poor dieting, or thyroid conditions. Whereas type 1 diabetes is an autoimmune disease in which the pancreas is unable to produce a sufficient amount of insulin to sustain healthy blood sugar levels. My sister was diagnosed with type 1 diabetes almost 7 years ago, and in these years I have seen how this disease has affected her, myself, and my parents. My family, my sister especially, has dealt with the confusion and sometimes ignorance of others regarding her disease. I don't blame other people for being confused or asking questions, because I was unaware of this disease until my sister was diagnosed. Now that I am educated on the disease, I want to spread awareness about what type 1 diabetes really is and how it can affect people mentally. I interviewed my older sister Samantha, who was diagnosed with type 1 diabetes almost 7 years ago, to give you information about the disease from the perspective of a teenager. Did you know anything about type 1 diabetes prior to your diagnosis?
No, I did not. I only thought of the word diabetes, and I thought just of type 2.
Do you have an insulin pump? If so, what kind?
Yes, I have an insulin pump. It is the Tandem T-Slim, and it goes to my arm and gives me insulin.
Do you have a continuous glucose monitor? If so, what kind?
Yes, I have Dexcom on my arm, and then I look at it on my phone, like that.
How does being a type 1 diabetic affect your schoolwork?
Sometimes I have to miss school if my blood sugar is too high, and then I'll go low in class or high in class, and that I won't be concentrated on my schoolwork, and I'll be concentrated on my blood sugar, and it distracts me.
How does being a type 1 diabetic affect your mental health?
You can easily get down if you have a bad day with your blood sugars, and your mental health also affects your blood sugar, so if you're stressed, your blood sugars will be high or they'll be lower.
How has the type 1 diabetes community impacted your life?
The type 1 diabetes community makes you feel like you're not alone, and it helps you to learn new tips about how to handle your diabetes and just motivates you to take care of yourself.
Why is advocacy for type 1 diabetes important?
Advocacy is important because a lot of people confuse type 1 and type 2 diabetes, and they're completely different diseases, and some people are misdiagnosed with type 2 and maybe type 1, and some people have died because of that.
I also wanted to show a parent's perspective of type 1 diabetes, so I interviewed my dad, Mike, who is very involved in San Diego's chapter of the Juvenile Diabetes Research Foundation. How has having a daughter with type 1 diabetes impacted your mental health?
There's a lot of worry about her condition, about, when there will be a cure and how she'll go about her life and how things have changed for her.
Can you describe how your daily routine has been changed as a result of having a child with type 1 diabetes?
Monitoring her blood sugars, especially overnight.
How do you help your child manage their diabetes?
Encouragement. When she was initially diagnosed, she was 11. She was a few months shy of being 12, and she pretty much took it on herself pretty early on as a young adult. We don't overmanage her. We let her manage it herself.
How has the type 1 diabetes community affected your life?
In a positive way. There's a very tight-knit community here, not only in San Diego with Juvenile Diabetes Research Foundation of San Diego, but nationally with the JDRF from a national basis and also an international basis. So our family's been very involved with JDRF. The families that we know that have been affected by this disease, there's a lot of them, and it's a very supportive group.
Why is advocacy for type 1 diabetes important?
Advocacy is important for a number of reasons, for research dollars, but also for advocacy amongst the lawmakers to pass laws and to get funding properly allocated for research, but also for improvements in technology and also for access. The price of insulin also is a very big issue. The price of insulin has gone up hundreds of percentage points over the last 10 years, advocacy takes on a lot of different aspects, not only for funding research to find a cure, but also for access to technology for folks, and also keeping insulin in a price range where people can afford to have it. It's not a if with insulin you have to have it if you're a type 1 diabetic. Your body's no longer producing insulin, which is different than type 2.
To allow you to see what being a type 1 diabetic entails through the eyes of a child, I interviewed two 7-year-old boys named Holden and Nolan. How old were you when you were diagnosed with type 1 diabetes?
3.
Do you have an insulin pump?
Yeah.
What kind is it?
A pod.
Do you have a continuous glucose monitor?
Yeah.
Is it the Dexcom?
Yeah.
How do you feel when your blood sugar is high?
I'm whiny.
What do you have to do before and after you eat your lunch?
After I have to bolus myself.
Holden, do you ever have to leave your class at school because of your blood sugar?
Yeah.
Do your friends at school ask you about your diabetes?
Yeah, sometimes.
Do they not really know what's like an insulin pump or like
Yeah.
a CGM? Yeah. What do you say to them when they ask you questions?
I just say something doesn't work in my body as well as it works in your body, so I need something to help it.
That's a good answer. Do you go to diabetes camp in the summer? Yeah. Do you like it?
Yeah.
Is it fun to hang out with other diabetics?
Mhm.
Yeah. How old were you when you were diagnosed with type 1 diabetes?
1, I think.
You're 1. Do you have an insulin pump?
Yes.
What kind?
Army pod.
Do you have a continuous glucose monitor?
Yeah.
Yeah. Is it the Dexcom?
Yeah.
Yeah. How do you feel when your blood sugar is low?
Shaky.
How do you feel when your blood sugar is high?
Thirsty.
What do you have to do before and after you eat your lunch at school?
Bolus.
You have to bolus, yeah. So you give yourself insulin? Do you ever have to leave your class because of your blood sugar?
Yeah.
Yeah. And you go to the nurse's office like Holden? Do your friends at school ask you about your diabetes?
Sometimes.
Sometimes. Do you show them like your pump or your CGM?
Yeah.
Yeah. Do you go to diabetes camp?
Yeah.
Is it fun? Yeah. I conducted a close analysis of my sister's blood sugars over 2 24-hour periods to show what this disease entails. I tracked her blood sugars throughout the day using the Dexcom continuous glucose monitor. The next day, I asked her about what could have caused her blood sugars to go high or low. In these two pictures, the red circles represent high blood sugar peaks. The blue arrows show blood sugar spikes and blood sugar drops. The yellow line is the goal blood sugar, and the green box is the current blood sugar. If you look at the picture to the left, you will see that Samantha's blood sugar spiked at around 8 a.m. She had a calculus test this day, and the stress from the test caused her blood sugar to rise. If you look at the picture to the right, you will see a green box with the number 388 and 2 arrows pointed upwards. 388 is a very high blood sugar level and can be dangerous if left untreated. The 2 arrows mean that her blood sugar will continue to increase if she doesn't give herself insulin. Her blood sugar was at such a high number because her insulin pump was not delivering insulin properly through the cannula. Here's an overview of the typical supplies a type 1 diabetic uses each day. This is the T-Slim insulin pump. Through this pump, you are able to deliver insulin through the tubing and into the cannula, which attaches to either an arm or a stomach. Here's a vial of artificial insulin, which is used to regulate a type 1 diabetic's blood sugars. Insulin is taken from the vial into the syringe and then transferred into a cartridge, which is then put inside the pump. The pump is then attached to the body using this. It works as a stamp, so the cannula is inside here and then you stamp it onto your arm or stomach. Sometimes the pump doesn't work and a diabetic will have to give themselves insulin using a regular syringe. Type 1 diabetics have to test their blood sugar 7 to 8 times a day. In order to test their blood sugar, they have to use a lancet inside of this to poke themselves to draw blood. They then put the blood on a test strip and insert it into the meter, which then gives them their blood sugar reading. There are devices such as the Dexcom which monitor a person's blood sugar every 5 minutes. Since the Dexcom is continuous, it gives diabetics the ability to test their blood sugar less often. The Dexcom, pictured here, attaches to a person's arm or stomach and reads their blood sugars every 5 minutes. The Dexcom is attached using this onto the arm or stomach. In order to keep the Dexcom in place, you have to use a form of medical tape, like Grip Grips. Before attaching an insulin pump or a Dexcom, you must use an alcohol swab to disinfect the area of skin, and then use a skin tack wipe in order to make sure the adhesive sticks. When a type 1 diabetic's blood sugar goes low, they must raise it immediately. Two typical products that are used to raise blood sugars quickly are glucose tabs and apple juice. All of the supplies I just showed are necessary in order for a type 1 diabetic to live. Without insurance, these medical supplies are very expensive and create a financial burden for a lot of T1D families. I looked at the bills from the medical supply companies, so I was able to see the retail price of each product and how many were purchased per year. Once I found the yearly cost of each individual product, I was able to estimate the retail cost of diabetes supplies for an entire year. Included in the total is the cost without insurance of the 4 necessary endocrinologist appointments per year. After all of the calculations, I found that the total cost of type 1 diabetes expenses per year is about $40,035. If you or someone you know is experiencing extreme thirst, frequent urination, increased hunger, dramatic weight loss, or vision problems, please consult a medical professional immediately, as you or they might have type 1 diabetes.